Moving forward, let me introduce the next panel, which will share their insights on today's health economics and health insurance landscape, and is sponsored by Sarani Biointegra Private Limited. We'd like to thank them for their support to make this panel possible. Please join me in welcoming our panelists, Chhitiz Kumar, Business Leader, Precision Diagnosis and Connected Care, Philips, Monika Sood, Co-founder and Partner, Arete Advisors, Niraj Didwania, Head Corporate Development and Investor Relations, Healthcare Global, TCM Sundaram, Founder and Managing Director, Chhitiz Ventures, and our moderator for this panel, Rema Subramanian, Co-founder and Managing Partner at Ankur Capital Fund. A quick reminder to please keep your devices on mute. Over to you, Rema.
Thank you, Shivangi. Thanks to Mumbai Angels for arranging for this session. Today, healthcare is at the midst of, while we are in the midst of a black swan moment, and it has disrupted every industry and the way of life for everyone. What has turned is the fact that the entire healthcare sector has been turned upside down. On one hand, we have healthcare is in great demand by those stuck by COVID, which is just a small fraction of our population, but has shut the healthcare system for everyone else. So on one hand, while there's insufficient capacity for COVID, which has drastically reduced demand for other illnesses. It's a peculiar situation where we have overworked health workers on one hand, and we actually have furloughs of doctors and hospitals going through a bleed because of the fact that there isn't enough demand is there and that capacity is underutilized. Right? And on the other hand, we also have the fact that the behaviors are changing. Like the previous panel mentioned, is about whether it is digital, whether it is machine learning or AI as artificial intelligence is all creeping in. And while the traditional healthcare sector has been slow in adopting many of these in the past, it actually has seen a very drastic adoption in the last couple of months. And I have here with me a panel which consists of folks from across the healthcare spectrum, and all of them are specialists in their field and would be able to share with us as to how they're seeing this entire thing being played out and what are the opportunities for both entrepreneurs and investors. Thanks to my co-panelists for joining in. I would like to request Chhitiz to start with introducing, and then can each one of you just give a small introduction of your background and what your organization does before we move on to the questions.
Sure. Thanks, Rema. Thanks for this. My name is Chhitiz. I am the business leader for Precision Diagnosis and Connected Care at Philips. Prior to joining Philips, I've worked in the financial services with GE Capital, and before that in the healthcare side with Johnson & Johnson. I also have the privilege of starting up a small venture within Philips and scaling it up, the radiology PPP across 2 states of Haryana and Jharkhand, and really serving at the bottom of the pyramid and making a successful exit last year. So I've been in the large corporates, but I've also experienced the fun of being an entrepreneur within a large organization.
Oh, that was a very interesting thing that you did.
Yeah.
Niraj?
Hi, everybody. My name is Niraj Didwania. I head Investor Relations and Corporate Development for HCG. HCG is one of the largest cancer hospital chains in India. My background is I've been an investment banker all my life, and I actually became part of HCG to take the company public. At HCG, I look after our investor relationships. I also look at M&A for the group. And also we've started a small corporate VC desk where we make early stage investments in disruptive healthcare, health tech, which may be outside the oncology domain also. And thanks so much for Mumbai Angels to invite us, and I look forward to a healthy discussion with the panelists.
Monika?
Hi everyone, this is Monika. I am a co-founder and partner at Arete Advisors. We started Arete Advisors about 7.5 years ago. And I've been doing consulting in the healthcare space for the last 20 odd years. We work with both providers as well as investors when providers and help providers across areas of performance improvement, helping them with business plans, etc. and with investors on commercial diligence when they're looking at investments in healthcare. Yep, thank you.
Interesting, Monika. TCM, I would have said that nobody needs your introduction because I'm sure every budding entrepreneur in this country would be looking you up. So just like to talk, but still I would let you speak about what you guys do. And then I'm going to start off with, I'm going to pose a question to you as well. So you could continue that. How are you seeing the new ventures coming up in the space of healthcare services, whether it is diagnostics, treatment, telemedicine, artificial intelligence? So can you give, because you must be receiving, your inbox would be filled up with proposals coming in every other day. So I would leave it to you to introduce yourself and then start off the discussion with what you're seeing coming in.
Sure. Thanks, Rama. Thanks, my co-panelists and other participants. I'm Meenakshi Sundaram, known as TCM in the industry, founder and managing director in Chhitiz Ventures. We used to be known as IDG Ventures India. We are into our Fund 4, and we have been investors in health tech right from Fund 1. So we have done devices, we have done biotech, and lately in Fund 3 we have done more and more of digital health, and also asset light models for full stack solutions, right? So one thing that we've always been challenged initially about saying that, are there enough investors? If you make an investment in seed or A stage, whether there are enough investors to come behind you to fund the Series B and C for scaling the company. That has been one of the biggest challenges that we used to think about 10 years ago, right? But now with digital health coming in and the new business models coming in, there is a lot of interest which has come. Just like Dr. Kishore Kumar mentioned in the last panel, we have seen multiple companies which are looking at telehealth. In fact, we have one which started with, in terms of helping a company called Healthplex, which started with helping doctors in terms of triaging. So they are able to manage most of the questions which used to be asked by the junior doctors initially. Now can be handled in the digital world by the patients themselves giving the standard questions that can be answered. That helps by the time the patient walks into the doctor's room to be able to give 3 most likely diagnosis and potential recommendation, right? This actually improves the productivity of the doctor in the sense that most of the time doctors tend to actually absorb information and then they do the triaging in their mind, right? And they are doing multiple things at the same time. And so given that background, this actually helps. We have got quite a few companies we have evaluated which keep doing this. Now, during COVID, one of the interesting things that has happened earlier, this was like Dr. Kishore said, generally it cannot be forced on them. They have to see the value in it, right? Now, during COVID, most doctors could not go out to their own clinics. And another important thing that has happened is that the patients also, they were not willing to take in to be able to give. So this Healthplex suddenly found a new business model saying that in addition to just helping the doctor, now you can actually do consulting. They created a video consulting also, and very quickly it got adopted, which was very surprising to us. During COVID, this happened. Obviously, there are even some of the diagnostics that requires a physical look now are being conducted. There are companies like DocSap and MFine which are doing this, starting with consulting and deep consulting. And after that, actually, then the rest of diagnostics starts. In case of diagnostics, we started off initially, as the opportunities was mainly saying that, okay, I can collect blood and then do it. Now there is a lot more AI and ML which is going in to be able to do most of the diagnostics. We have a company called Chhitiz, which can actually do the blood analysis completely based on visual inspection and not based on the PCR, which takes much longer. And they've actually built a device which is possibly a tabletop, which can actually handle the whole thing. And the reports come within a couple of hours instead of waiting for 24 hours. And more importantly, the assay information in terms of how things look like are completely digitized, which means it's AI driven, where actually you can get the snapshot of, how the, what was the actual number of, WBC and others which have been seen under magnification. And so those are things which are coming up, and similarly, X-rays and CT scans are all going to go into digital analytics, and I think interpretation and later possibly diagnostics will be left to the doctors, but actually initial analytics is going to be more and more done by machines. And we see a lot more deals coming through in the last 3 months in this space. But there's a lot of noise, and and what we look for is companies which can truly disrupt something, not be the 25th one which is starting the same business.
Absolutely.
So to that extent, the uniqueness part is still a little lower in my mind, but it's a good trend to start with.
Actually, you brought up a good thing about uniqueness. And I would just like to bring up the question around diagnostic equipment, for example. In the last few years, with a lot of support given by Biotech and other things, there's a huge development of diagnostic equipment that has taken place in the country. But we do see is the fact there's a whole lot which is around the whole pathology space, and many of them are Me Too's as well. So I'd like to ask Chhitiz about what, coming from Philips, what are you seeing and how are you seeing the startups coming in the space? Are you seeing them as competitors, potential competitors? Are you seeing, are you guys going to be doing differently? Because there is possible, like what TCM mentioned, that there are some innovations that are taking place in the country. Are you looking at M&A opportunities here? What do you see from the space that you are in?
Yeah. Rema, that's an absolutely great question, and at a very appropriate time. Actually, if you look at it, COVID-19 was, beyond everything else, was a wake-up call for India. It was a wake-up call because when countries starting acting in a very nationalistic way and saying that we'll probably not be able to supply ventilators, which were all being happening in a free trade one, that became a wake-up call for India, saying that we need to get far more independent, not dependent on the imports that are coming from outside. And that behavior out there also helped a lot of multinationals to relook at the supply chains that had got concentrated in China. And we also see now that little bit of issue that is going on between China and India. I think these two, if you couple it together, creates a very great ground for entrepreneurs to enter into this market on the medtech side. And that's a piece that I think, Rema, that's going to go up out there. If you look at it, what has happened of late, when ventilators became a challenge, Indian government placed quite a few orders with the local Indian players and said, like, why don't you guys go ahead and do it, and we will support you. I clearly see those kind of opportunities really coming up in India. I also see that there are opportunities when the supply chain balancing is going to happen, and I see that that's going to happen in some form, shape and form, because there has been a lot of geo risk and geo concentration happening in China. I think that the multinationals will relook at the supply chains. That is going to make an impact out there. If I were to look and talk to entrepreneurs, what kind of things that you should be cautious of when you are looking in this kind of space, there are 4 things that clearly stand out. TCM spoke about innovation / uniqueness, about what you're doing. Quality. Healthcare is all about quality. That is something which you cannot take for granted. it doesn't work 90, it works 95% of the time is not good enough in healthcare. It has to work 100% of the time and every time. Third is about how much is the access to capital is there for entrepreneurs, especially when they're coming in new into this area. And finally is how much is the access to markets and when you are looking at access out there, you should not just consider India as a market. Clearly look at opportunities that will work in India can pretty much work in markets very similar to India. And I'm talking about markets in Asia Pacific, I'm talking about markets in Africa. Those are the markets. So don't just get constrained by what is the market demand that I can cater to only in India. That will not make a viable proposition to a great extent. But the moment you start thinking that, okay, there could be a market outside, that's where it becomes pretty interesting.
That's a very good point that you brought up out there. And on the same note of looking at what are the kind of opportunities that are there, Niraj, I would like to ask you a fact around the drugs and drug discovery. For a long time in the VC world, unless you are a specialist uh, biotech investor investing into drugs industry, it's outside the scope of most of us because of the fact that you don't have the kind of portfolio you would need. You would need 10, 15 ventures to be invested in, and you have to have the staying capacity of doing it over 15 years because these are very long life forms, right? But things have been changing due to the entire digital layer that's come onto all of these as well. So while we have heard about how digitization is helping on the other aspects of healthcare, could you share with us what are you seeing in the space of how that's impacting the drug and drug discovery space?
Yes, so I think I'll be speaking from experience because I come from a financial background, but of course I work with a healthcare group, so I'm not speaking from qualification. What we are seeing is, if you see the traditional drug discovery was about taking the work and research that your predecessors have done and take it ahead a couple of notches, and it would take a long drawn period to work on that at one leg, and then deliver this in the routine delivery way, which is either an IV or a oral medication or maybe even nasal. What we are seeing now is both these things are getting disrupted. One is that the drug delivery process itself now, because there is so much voluminous data is coming out when you do, let's say, a molecular diagnostic test or a gene sequencing per patient. I think a couple of panels ahead, somebody was talking about how research and clinical trials are getting conducted. So now the quantum of data that is available per patient, per test, per indication, you cannot really make any sense out of it unless you use data scientists. So in fact, I think that's the big disruption that's happening in drug discovery. That one, the cycles of innovation are getting shorter because of the data tools, and in fact, the new age biotech company may actually not have a lab. It may be working out of a computer and coming out with the next new drug. So I think one is on the drug discovery part. That is one of the innovations, and the second is on the delivery part. So of course, we are seeing more and more novel delivery mechanisms. So whether it's a nanoparticle, nano delivery systems, which is how can you traditionally escape some of the, let's say, the gastric bypass or some other standard delivery procedures to increase the efficacy of the drug. So both of these are the two innovations that we are seeing, and I think that's where India can also try to get an edge, because I think the Indian clinical talent is well proven, but I think we are severely lacking. I think somebody was calling India the pharmacy of the world, but when you look at core IP coming out of India on the clinical side or novel innovative products, that's really where we are completely lacking. But now, given the fact that it's not just the clinical capability, but the clinical and the data capability, there is a good edge that we can potentially work on. But of course, it's going to be long term. Nothing happens overnight, but at least we can start thinking of walking in that direction.
Good. I mean, at least it's a good start, right? And we're seeing this now actually, like what TCM mentioned on the entire solutions side is one area. And Alexa did mention that about the entire diagnostic space that we are seeing this. And now you're saying that even in drug and drug discovery as well, we should be able to invest in that. That opens up a huge opportunity for both entrepreneurs as well as investors, right, who are looking at the space. So it's really at this COVID moment, we're saying that we're reaching a point of maturity for the healthcare sector, VC investing healthcare sector in the country. Right? That's good.
Yeah, I mean, just to add, I mean, we are all today in the COVID environment, we are all chasing this drug discovery, right? We are chasing a drug to be discovered for COVID cure. We are chasing discovery of a vaccine, and we are seeing how helpless we are. I mean, it's been almost nearing a year, and it's anybody's guess when we'll see any results.
Absolutely, right. Monika, coming to you in terms of the fact this was all about what are the opportunities that are coming up, right? But as we are today, and we have this whole, the COVID on us, and you've been interacting with the sector, across the sector. What are you seeing? How are you seeing hospitals change the way that they are functioning? And what are the kind of solutions are they seeking out?
Right. Okay. So when we look at the environment in which today hospitals are operating, I think they are facing two issues. One, there is pressure on pricing and realization because a large chunk of our patients are coming through insured private medical insurance as well as government and state insurance companies. So huge pressure on pricing. And on the other hand, you have rising costs. And in this element, somewhere in between, hospitals are trying to figure out a way to get enough returns to justify investment into the sector. So there are 2 or 3 things that are happening, I think, that hospitals are trying to do today. One, I think on the CapEx side itself, I think they are trying to optimize. So initially you would set up, you would spend anywhere between $1 crore, $1.5 crore to set up per bed to set up a tertiary care hospital. Now, hospitals are trying to see if they can set it up at a lower cost by looking at leasing options, by partnering with developers. So at least the land and building costs you can pass on to somebody else and you reduce your cost. That's one. Second, different out-of-hospital formats are being experimented with, right? So rather than have everything inside one hospital, can I pull IVF out? Can I, eye care goes to a different area?
Aisha is thanking you.
I think, you can pull out some of these formats. So obstetrics becomes a separate hospital where, again, the cap cost is not as high as in a tertiary care hospital. And you leverage the cost that you've spent in tertiary care much better. So that's something that is happening on the new formats side. One of the other things that is happening is using technology. Hospitals are also trying to become more efficient. So trying to look at saying, how can I reduce my operating costs? So one, driving down length of stay for patients, whether it is through partnering with people on the home care side. Today, you can set up an ICU at home and deliver care at a much lower cost than, let's say, a hospital. Whether it is in terms of longer term care being moved to different formats. So huge reducing your infection rate. So significant focus on reducing on improving efficiency and reducing length of stay. The second element is around saying, how can I manage my cost structure better? So how do I bring in technology, for example? Do I need 100 security people in a hospital, or can I use access control and reduce, let's say, manpower costs? Today we have, on an average between 5 and 6 people per occupied bed in hospitals. So, so that's something that the hospitals are trying to do. The other element that they are focusing on is around how best do we manage materials and material cost. That's a big chunk. It's about 25% of any hospital, 20 to 25% of any hospital's revenue. And so becoming more efficient in terms of reducing wastage, reducing pilferage, also looking at saying where allowed, how can I reuse, combination of these to try and bring down the cost. There's also this whole element around the government, looking at reducing, either putting a cap on price of consumables or restricting margin. So hospitals are now looking at saying, how do I derive better margins from my services rather than be dependent on consumables and implants to drive margins. So I think they are working on driving down cost, and the COVID epidemic has forced people to actually focus a lot more. So we've seen a lot of cost optimization in the last few months, and I think this is going to continue post COVID also.
So I'm going to quickly ask TCM before he jumps off. He has to log off at 5:30, he mentioned. So would love to hear his thoughts on what does he have to say, share with the entrepreneurs and investors in the audience today before he logs.
Yeah, I think one of the things I also wanted to talk about from the treatment side, and what we have noticed, and we have now backed 2 companies and one more is in that space where we signed a term sheet, is these are asset light full stack models for specific illnesses. So we have backed a company called onco.com, which is for all anything to do with cancer, but people come for second opinion, people come for treatment, people come for diagnostics, and also life cycle management during this time, also counseling and other things that are required to be done, or palliative care capabilities that need to be built in. Similarly, we have one in obstetrics in infertility treatment, and one more is in the pipeline. This is a new model that is coming up because I think capacity in India from beds per 1,000 or beds per lakh, on one side you will say that it is abysmally low compared to who measures. But if you look at metros, especially Bangalore, actually it's the other way around, right? It is 3 times the who measure. Capacity utilization is anywhere between 40-50% only. All the listed hospitals talk about capacity utilization somewhere in the 60-62%. I'm talking about pre-COVID levels, right? And so those are some of the ways in which you can actually do a much better job without necessarily being capital intensive. In terms of entrepreneurs, I think what we like to look at is the unique problems of India, which is, I think telemedicine is trying to solve. I think where there could be verticalization, where some cases could be horizontal, some will be vertical. Diagnostics, similarly, like we have one in pathology space, there will be more which will come in terms of radiology and other areas. And I think what can be scaled here can be taken global. And here I'm not talking about can be taken global only to developing markets, actually can compete in developed markets, right? Because I think the enormity of volume that you get in India in terms of training your AI engine is something that I don't think you can get anywhere.
Absolutely. I mean, I think that's really true. I mean, we actually have the access to data like nowhere else, right? Name it.
Yeah. Yeah.
Thank you so much.
I'm sorry, I will have to jump off.
Thank you. Yeah. And for the others as well, because I think we have a couple of minutes left before we have to log off. It would be good to get your thoughts on. I think because we have 3-4 minutes left. So can each of you take time to talk about, what you're seeing from the entrepreneurs, your feedback to the entrepreneurs. Chhitiz, it would be good to hear from you, for example, that you mentioned about leadership. You had leadership at Phil, so it would be good to understand from you what are the kind of challenges that entrepreneurs would face. And similarly, Niraj and Monika, it would be good to hear from you all. What are you seeing? And what is your feedback to the entrepreneurs in this group out here before we log off? Final.
Thanks, Rema. So my message to the entrepreneurs would be that this is a crisis. Don't panic. At the end of this crisis, people who will emerge out would be the people who would have utilized their capital better and who would have the leadership to survive this. So if my message to the entrepreneurs would be that if you are looking at what should be your leadership look like in this kind of a crisis scenario, it should be very clearly a visible, calm leadership. As a leader, you're not going to panic out there. Second, you will have to come and display your leadership commitment right from the forefront with the troops out there. And whatever your communication must have been previous to the COVID scenario, it has to go 3 to 4x now. If I look at what has been our leadership style in Philips, we have said that the leadership now in this kind of a situation gets a triple duty. We are committed to making sure our customers are served. We are making sure that while we are at the forefront serving our hospital, healthcare, and going in front of the customer in the hospitals, Make sure your employees are safety, all PPEs, etc. Everything is taken care of. And third is ensure the business continuity. It's a tough economic environment. Conserve cash, but play to make sure that you satisfy your customer the first. Those are the lessons that I would say would work well.
Thank you. And
okay, maybe just last, an input. I think for the entrepreneurs, the healthcare sector offers huge opportunity. I think thanks to COVID, it's come out kind of in the forefront. There are opportunities on indigenous manufacturing of medical devices technology. I think there's a huge opportunity opening up thanks to the National Digital Health Mission that has been announced by the government. I think any solutions that help improve efficiency within healthcare delivery, whether it's telemedicine or home care or remote monitoring, is going to be very, very beneficial to the sector and ensuring access to a larger chunk of population. So any solutions around these would do very, very well.
And Niraj?
Yeah, so I would say that one is have a complete laser sharp focus on your value proposition. What is it that you're offering? Who are you offering it to? Who's your customer? How is it different? And what are they willing to pay for it? So completely be laser sharp focused on that. If you miss an eye on that, then the whole cart will topple. And the second, I would say, picking up from what Chhitiz was saying, that it's a long haul. It's a long term. I mean, there will not be anything that will happen overnight. And it's a cliche that, it took 20 years for somebody to become an overnight success. So be prepared for the long term. And the third, I think, just from a lighter note is, just assume that you may have Reliance disrupting your business. You have to build a business that you can still withstand if a Geo comes in and raises billions of dollars, gets all the global leaders. And if you can still withstand, that's the mindset you should have.
And actually, it was, there were a lot of good points that all of you guys brought out. The amount of opportunities that are there in this space is really huge, right? I mean, whether it is directly allowing access to people to healthcare itself is one whole area. And then looking at how do you make the existing infrastructure, existing healthcare more efficient is a huge area. And if you go into the subsectors within those, like what Monika said, is again a huge area. And if you could take the third bucket of innovation, whether it's drug discovery, diagnostics, or the entire area of artificial intelligence, it's another area. So if you look at each of these sectors, the amount that has opened up, while COVID, it would be inappropriate to say COVID came in at the appropriate time for the healthcare sector, is not how I would put it as, but just from an opportunity of how that this has offered to the healthcare sector to go on this huge you're sitting on a gold mine at this point of time, right? I mean, for whether it's an investor or as an entrepreneur, I think Reliance, even if Reliance comes in, there's a huge other opportunity as well as how. Thank you very much for joining me here, and I hope the entrepreneurs and investors in the audience would have had something to take away. Thanks a lot to the Mumbai Angels team for organizing this. Thank you.
Thank you,
Thanks,
Rama.
Thank you.
Thank you, panelists, for this engaging discussion. I'm sure our entrepreneur audience has found some points that they can take and maybe ponder upon and see what they can do